Hello everyone, it is Kat. I wanted to do a video kind of addressing our health and our health journey. It is January 2023 now, and we've had a lot go on this year as far as our health. That actually started January of last year. So I thought it would be a good time at the end of the year, a good time just like to kind of go into the new year with being super open about my health and all that stuff. There has been stuff in the past that I haven't really wanted to talk about, but I feel like we might as well talk about it. It's not that big of a deal. So I will just kind of go through everything from when it happened to now. Keep in mind that we have DID. So some things may not be exactly accurate as far as timing goes. Did not script this, so this is just literally from memory, which means that there may be switches and there may be super heavy dissociation. If it lasts too long, I'll cut it out, like if I'm gone for like minutes. But otherwise, I'm just gonna kind of roll with it because that's just part of my life. And that's what I'm sharing with everyone here. So and trigger warning to talk about, menstrual cycles and vomiting and just like medical stuff, ER talk. I don't know if that might trigger somebody, but now is your time to click off and go somewhere else. Watch a different video or, just not watch it at all. Okay, so in January, I noticed that my periods had increased a lot. And lasting like 2 weeks at a time, like heavy flow and that kind of stuff in January. So by February, I had a continuous period. I never wasn't on my period by that time. And some days would be lighter than others, and some days would be like really bad, but it was still kind of within what a period looks like for us. Our periods are really heavy, and we have experienced a lot of pain. We do get cysts and that kind of stuff. So our normal period is still like not great, but it was just that at the time. So then we went from February to May where I was just bleeding. Maybe 1 or 2 days I would get off, and every other day I was bleeding. I was bleeding like some days when I would have a normal cycle. It was so bad that I was like, my hemoglobin was low, my iron was low. They were like, well, you don't need a transfusion like right now, but they gave me saline. Anyway, so I'm getting ahead of myself. So it was really bad when I finally went to the doctor about it in May. I was like it looked like and felt like I was in postpartum. I do have a child, so I'm very aware of what that means, what that feels like, what that looks like, and that is exactly what was happening to me. No chance of me being pregnant. That was just what was happening to me. I did have an IUD at the time, but I had had it for a year with no issues, and then all of a sudden there were issues with it. So I don't really know, so in that time we got our IUD checked and it was fine. And when we went to the ER, they were like, it's fine. And then we went to our gynecologist again and it was fine. But at that point, we just decided to take it out since I'm not in any way, like it's not possible really for me to get pregnant in my day-to-day life. So I don't have to worry about that. But taking it out did help a lot with the bleeding every single day. And I got on birth control, like the pill birth control. at the time because I hadn't been on like a hormone birth control since I was like 17, and I'm 28 now. I was 27 at the time, so it had been like 10 years since I had been on any kind of hormonal birth control. So we went on that, and combined with like that, combined with having so being on the birth control and having my IUD removed did help a lot. But when I did have a period, they were still really, really bad, like postpartum bad. So we ended up, after that, they scheduled us with an endocrinologist. So, oh my gosh, okay, so we went to the ER because of it. They did all that stuff. They basically were like, you just need to see a hematologist, possibly, but you need to see endocrine because at that point, my blood test was hypothyroid. So the ER doctor was like, yes, you have hypothyroid. And we thought, like, okay, that's it. Like, we're done. That's the problem. It was not the problem. So we went to endocrine, which took 3 months. So we were just bleeding like heavily on our periods and like still having more cycles than normal. But so we went to the endocrinologist, which they scheduled 3 months out. Finally went there and they did more tests and they were like, actually, you're not hypothyroid. Like, it could have, shown up there because of like the stress of being there and like how much your body was going through with all the bleeding. Because when they took the next test, it was fine. So we're like, okay, well, that's probably not it. But then he was like, it sounds like you have a blood disorder. And I was like, yes. The ER talked about that being a possibility, but didn't schedule me for one. And he was like, no, I'm really concerned about your bleeding. You need to see a hematologist, because it wasn't just my periods. Like, if I got scratched, I would bleed so much. It would take so long to clot. My gums were bleeding, and I brush my teeth pretty much every day right now. Like, we're not like super traumatized or anything, so we're brushing our teeth, we're doing the whole thing. Every single time I brush my teeth, my whole mouth bleeds. Just like my whole mouth bleeds. I bruise easy, because I was taking iron and vitamin D at the time. My blood was like okay with those levels, so that was good. But he referred me to a hematologist. I ended up in the ER again because the bleeding was so bad, because at that point I had come off my birth control. I'd like ran out, and it was really just like pointless. After I went to endocrine, they were like, we don't think that's the problem. So I came off of my birth control just to see what my body would do with no birth control and with no IUD, and just like be natural and see how it goes. It didn't go well. So we talked to our doctor, talked to my parents-in-law are doctors, so we talked to them, talked to my mom, my stepmom, she's my mom, but we talked to her and like talked to all these people, and I don't remember if I just said it, but the hematologist's office talked to them, and everyone was like, go to the hospital. Like, you're losing too much blood. This is not good. Because the hematology appointment was 3 months after endocrine. So at that point, it had been 6 months since I went to the ER, because it was 3 months and then another 3 months to see hematology. So they were like, okay, well, we don't have an opening for hematology earlier than what you need. So go to the ER and they may be able to help you. Went to the ER again, and this doctor was even nicer than the other one. He was so amazing, and he was like, I see you're, waiting on hematology, so we're just gonna run a full blood panel. And they checked for like von Willebrand's and like hemophilia. It's a blood thing. but like they checked for all that kind of stuff and nothing was there. Everything was like relatively normal. There were 7 of the things that were red flagged in my medical chart, but then when I talked to the doctor, they were like, well, I mean, it's not like that big of a thing. It's not like super off to where you need to be medicated for it. So then they were like, okay, well, honestly, all you can do is wait for hematology now, but at least this like removes a step. At least when you go to hematology, you'll already have had all these tests done. So go to hematology 3 months later. Hematologist was amazing. Just like I was having such a great luck with the doctors and all that stuff at this point. So I ended up getting a more extensive blood panel done from him because he was like, clearly something is wrong. Like, we just need to figure out what it is. And all these other tests came back normal. So I'm going to do like tests that we don't normally run, like more rare tests that they don't usually do. And they found that my platelet count was good, but they did like this fancy test that takes like 4 hours, and he was like, a couple techs could do it, but I only trust one to do it correctly because it's so like you have to look at the blood while it's live, which I didn't even know was a thing. But basically my platelets aren't working correctly. Like I have enough of them, but they're not working correctly. And he said a couple other things were off, but that was like the main thing. So that was my results from that. Then I was like still, I think, waiting on some of the results when I got those results because it was so many different panels. It like went to different, it did different stuff. Anyway, so he was very concerned. So he sent me to a gastroenterologist because my stomach was whack. Sorry, my dog was absolutely freaking out. I don't know why. They're doing maintenance over here, so maybe he heard a maintenance person. I don't know, whatever. No one's at the door. So he was concerned, so he got me in with GI as soon as possible, which was amazing. I think I had to wait like 2 months for that one, or maybe even just a month. It was definitely shorter time. So after that, the GI doctor was amazing, or like nurse practitioner, I think. I'm not sure how all that stuff works. I'm learning as I go. But GI was like, this sounds like gastroparesis. Mind you, oh my god, I'm getting so sidetracked. There's like so much. I'm trying to like not make this video 3 hours long. Okay, so along with the bleeding, I was having symptoms that I've had my whole life, which is vomiting. I have been throwing up my entire life. I have been nauseous my entire life. Always just thought it was anxiety. Either that or I was telling adults in my life and they thought I was lying. I remember one time when I was in the 3rd grade, this is like one of those core memories, you know? I was in the 3rd grade and I had gone to the bathroom to throw up again, and I came back in the room and I was like, hey, I'm not feeling well, throw up again. And the teacher said, was there anyone else in the bathroom that heard you throwing up? Because she didn't believe me, because I asked to go to the bathroom to throw up all the time. I was always sick. That was the same year I got like 3 ear infections in a row. Like I was taking the antibiotics all the way through, but I just kept getting ear infections. So like for a whole month I had just like an ear infection that just would not go away. I had sinus infections all the time. I was breaking out in hives all over. And everyone either just was like, that's stress, or didn't believe me. I used to get car sick. Like every single time I got in the car, I would immediately get car sick. And my birth mother would always be like, oh, it's just in your head. Like you're just like making yourself nauseous somehow. Which doesn't make any sense. Like, again, I was just not believed for a lot of stuff growing up. So then I ended up taking a shower when I was 17, I probably mentioned this, but when I was 17, I was taking a shower. I had just walked home and was cleaning my plugs and passed out cold. Hit my head on the tiles. It ricocheted, so I have permanent brain damage in like two different places in my head. One is like speech, which is hilarious that I'm on a medication that makes my speech hard. But like speech memory, like I was slurring my words and that kind of stuff, and then I couldn't walk in a straight line. So I did neuro PT, blah blah blah. When I went to the doctor for that, mind you, I had to stay home 2 days before I got taken to the doctor. So I went to the doctor and I was like, I don't feel good, and they were like, you need Vicodin. And it was told to me that like I shouldn't take it. So I didn't take it because I was being told at the time I was an addict, even though I'd never taken pills. I don't know. Anyway, so I didn't take the meds, but they were like, you need to go to the ER and get some scans done because sounds like you really messed up your brain. But no one looked into why I passed out. I was like, why did I pass out? And they were literally like, well, malnutrition and heat exhaustion, I guess. Which at the time I was diagnosed with an eating disorder, but now I know that was just my gastroparesis, because that was really the only way I knew how to explain, like, I feel bad when I eat. It makes me feel nauseous when I eat. That was like always just, oh, it's anorexia, it's in your head, like, that's all it is. You need to just get help for your eating disorder and your stomach will be fine. It never was fine. And it's so funny, I have Facebook statuses from like 3 years ago, 7 years ago, 10 years ago, 12 years ago, being like, I'm so tired of throwing up. Like, I throw up all the time, throwing up again, late night of throwing up, like all the time. And I guess because we have DID and everyone was like taking bits and pieces of it, we never really realized as a whole how much we have been throwing up, or like our whole life, how much we've been throwing up. So that was a big thing that was happening, was we were just throwing up every day, multiple times a day, every day. Didn't matter what we ate, drank, whatever, we were just throwing up all the time. And we had tried so many different medications for nausea over the years. We had been seeing my amazing doctor. So I had like tried so many things. So when hematology was like, there's this stuff happening, whatever, go to GI. So I went to GI and they were like, I think you have gastroparesis, which my mother-in-law called like a month prior and was listening to my symptoms, and she was like, I think you might have gastroparesis. And I was like, the only reason I know what that is because over the years I have like looked into people that throw up as much as I do, like tips for throwing up so often, and gastroparesis was like a thing that kept coming up for people like that had the same symptoms as me. They were also diagnosed with gastroparesis. So when the doctor said it, I was like, okay, like that makes sense. My mother-in-law mentioned it, that I might have it just based on my symptoms. So she ordered a gastric emptying test, which I took, and I do have what do you call it, like delayed stomach emptying. Basically I had to drink something, it's like radioactive and then they like take pictures of your stomach and see like how fast you're digesting. So in the first 2 hours my digestion was fine, but in the last 2 hours, because it's a 4-hour test, so the last 2 hours is when I had the most delay. At the end of 4 hours, the average for people to have digested is 90% of that. So you would have 10% or less of food remaining in your stomach after 4 hours. I had 40 plus percent of food still in my stomach after 4 hours. And one thing I did learn from doing all my research is that gastric emptying tests only work for that day. And people with gastroparesis, or I guess other different things, you fluctuate how you digest, how well you digest. Depends on how stressed you are that day or how good your stomach feels that day. Some days your stomach will feel better than others for no reason that you can see, just is that way. So that was just a snapshot, and that was a good day for me. I was able to drink the whole protein shake they gave me, and I didn't throw it up. And some days I have a sip of water and I throw it up. So it really depends on the day. Speaking of, I should probably take a sip. My delicious decaf chai tea. So that was on a good day. So a normal day for me probably would be, I would have digested even less than math. Wow. So I had 40% left, 47. It's 43 or 47, and I could never remember which one. But that much still in my stomach. So basically I would have like 50 or 60% left in my stomach on like my bad days. Like today is a day where I just feel disgusting because I ate yesterday. So that happened, and then I changed insurance like right in the middle of all that. So then I had to get a new GI doctor, and the new GI doctor I'm seeing I guess like 2 weeks, the beginning of February. No, the middle of February. I go the middle of February to see my new GI doctor. I already talked to the receptionist who talked to the doctor himself and got back to me saying like he is willing to see me and like help as much as he can, but he may not know enough about how to treat gastroparesis to feel confident helping me, because I have already gone through all the normal medications. A lot of people will take Zofran. That's like the one of the big ones I see so many people take. It does not work for me at all. I have tried, I counted them up yesterday. I tried 7 different medications over the years to help with nausea, and none of them work. Absolutely none of them work. Because I've even tried some since seeing that one GI doctor. That one actually made it worse. Right after taking that, I always felt so nauseous and like would throw up. So I stopped taking that one after like 3 days because I was like, we're going in the opposite direction here. Absolute opposite direction. So I ended up going to the ER before that. This timeline, I'm sorry, it is just all over the place. I ended up going to the emergency room again after having my GI appointment in the middle because I hadn't eaten in 4 days. Like, I just couldn't eat. I was so sick, and it just like any little thing I would eat, I would throw it up. So I just stopped eating for like 4 days. Had drink maybe. The reason I drink out of these is because they make me feel better about the small amount that I'm able to ingest. I don't know if you can see it. So if I finish this in 1 day, that's a good day. That's a good day for this. Yesterday I drank way too much, and today I am paying for it. And by way too much, I mean I probably drank 2 cups of liquid yesterday over the course of the day, and that was not good. I'm trying out a new ramen, and I added way too much water, and I was like, I can't like not use this. And I was so hungry. I was like, I'm just gonna do it, and I'll pay for it later if I have to, which I am. But I went to the ER because, again, I actually had gone to urgent care, and I was hoping urgent care would be able to help me, just hook me up with some fluids. Like, I wasn't really looking for a solution from urgent care. It was mainly just like, I need help of some kind. And they were like, they didn't even charge me. It was so nice. One of the doctors just happened to be up at the reception. It was a really small, like, doctor's clinic or whatever. And the doctor was like, we don't treat gastroparesis. That is really serious. So you need to go to the ER if you're like this bad. Like, you can see like my face and everything was like not doing well. So I went to the ER again, and we waited for 12 hours in the emergency room. That was the worst medical experience I've had in years, literally years. This doctor was like, not even a doctor, they were like the other thing, nurse practitioner or maybe something else, I don't know. Um, but he was like, well, we checked your vitals, which was like four things. Oh my God, okay, sorry, I'm getting so sidetracked. So when I went to talk to hematology after I had gotten in with GI, and they were like, we think you have gastroparesis, and I had done the test, I told him like, hey, this is what they're saying, and he was like, oh yes, that makes complete sense with your blood work because you're deficient in so many things. We found out, I forgot to mention through one of the blood tests, that I was super deficient in vitamin C, which apparently can cause scurvy, which I didn't know was still a thing. Like, I just always thought like scurvy pirates, but it's vitamin C deficiency. So I was so deficient in vitamin C, I was like getting some of those symptoms. So I started taking 2,000 milligrams of vitamin C a day. Um, but the person like took one vial of blood, the hospital took one vial of blood and did like 5 tests, I think, and they were like, well, you're fine. And I was like, so it's fine because, okay, this is so bad, but this is just how it is. This is just how our brain is. So I went in the emergency room when we went back to get my vitals. Well, first of all, when they took my vitals when I first got there, my heart rate was high, and I like felt like I was gonna pass out, like I just didn't feel well. And the nurse didn't even look at my vitals. She literally just rolled away, like didn't say anything, didn't look at me, did nothing, like was talking with another employee across the hall. So the only reason I knew was because my meta worked in healthcare and knows what those numbers mean, and was like, oh my gosh, your heart rate is really high, but your blood pressure was normal, which is not good. So I get to the room where they like ask you what you're here for or whatever, evaluation, triage, that's what it's called, I think. And I fell out. Like, I was delusional, like everything was weird. The doctor was like, where are we? What day is it? What day just passed? Who's the president? Like that kind of stuff, because I was out, like completely. I got up because I was like, I'm fine, I can get up. I can just walk out, I'm fine. And I collapsed onto the floor. And my wonderful meta and the doctor picked me up off the floor and put me in a rolling chair. Not even a wheelchair because they were out. They put me in a recliner with wheels on it and wheeled me out to the hallway to sit for another 10 hours at that point. So I get back and the emergency people are like, you don't really need anything. And they were like, we can give you fluids, but you're not dehydrated. And me and my meta were like, how is it possible to drink and eat that little and not be dehydrated and not be malnourished? Now, if you've watched my videos for a long time or you know me in person, you know that I have been very small my whole life. And then when I got on all my meds and I had my baby like at the same time, I gained a lot of weight. Love it. Love being thick. It was amazing. I have lost over 20 pounds since November, and it is January. Lost over 20 pounds. Mind you, that is on all of my medications, where every single one of them side effect is weight gain. Weight gain, which is why I've been gaining weight. Haven't lost weight since right when I had my baby and I got on my second psych med. And that's when I started gaining weight. Now I'm on 4, so your girl was getting big, good, loving life. So the reason that I wasn't seen as malnourished, or maybe wasn't showing up that I was dehydrated, is because my body is literally feeding off of itself. Like, I'm not really intaking that much. My body is just literally feeding off of all of the fat that I had stored, whatever water weight I had, I guess. So they were like, well, we could give you a bag of fluids, but it's really just to make you feel better. Like saying to make you feel better for waiting for so long and then not getting treated. I was sobbing. I have never cried like that in a doctor's office in my life. And we were like in those rooms with just the sheet separates you. And I was sobbing. I was like, I don't care. I want you to feel bad because this is bullshit. Absolutely bullshit. So they were like, well, these are the only medications we can offer you. One of them was Zofran, and another one is like, I don't know, it starts with an R, like Reglan, something like that. Which my GI doctor told me specifically not to take because it can cause tardive dyskinesia, which I am very familiar with because my grandma has it from psych meds, and I am on 4 psych meds. So I'm already a pretty good risk of developing it at some point. I cannot afford getting on another one. Like, I just can't foresee that being a good idea. And she was like, oh yeah, no, if you're on psych meds, do not take it. Reglan. I don't know. You can look it up. It's a medicine commonly prescribed for gastroparesis. I looked into it even after that. Horrible reviews. I looked at people's YouTube videos because I love that and saw that a lot of people had really bad side effects and even had tardive dyskinesia when they weren't on psych meds and they had just started taking it. So like for them, it happened super fast. It did go away for them. So maybe it was like just those symptoms, but like once you've taken psych meds long enough, if you develop it, you can have it forever. Like it's something that doesn't always like go away. And that's what happened to my grandma. She's just been taking them for so long that she has the effects, like motor movement, her face tics, like she has a hard time controlling her face and that kind of stuff. So I'm like, I don't want to be at any higher risk for that. And the doctor just kept repeating the 2 medicines. I was like, do you not have any original words, or are you just like gonna quote your textbook? Because I already told you I was advised not to take this specific medicine, and the other one is written down for you in this cute little letter that I brought showing all the medications that I'm on and all the medications that didn't work for me or that I'm not allowed to take. It's like getting annoying even talking about it. So that was a shit show. Insurance changed, so now I had to get a different GI doctor with my new insurance. That's the one that said that he's not sure he can help, but he's going to try treating me. I don't normally ask for advice on here, and I think I don't really know how it's gonna go. It's very much like, I feel like because he said he's not sure he'll be able to help me, like he's not sure if he's qualified, I want to go in there with as much information as I can get for like all the options that may work for me or be good for me, and then we can talk about it from there. But basically all of the medications that are available for gastroparesis, tardive dyskinesia is a side effect of all of them, like a possible side effect of all of them. And, you know, I already tried coming off of one of my psych meds. So I'll just give list my meds for you. I've never listed all my meds before, but I don't know. I just feel like it might actually help me to get help, like helpful information from y'all, from other people that have been on these meds or however. But right now I'm on Lamictal, Lexapro, mirtazapine, and Seroquel. Seroquel I just added, and I added it to help with the vomiting. Again, thinking it was just anxiety and PTSD. I have, enough of that to share. So I always just thought that's what it was. It wasn't even medical professionals telling me like this is just anxiety. As an adult, I was encouraged by my doctor to go to a GI doctor many times, and I just declined every time because I'm like that, I guess. I have to wait till it's completely horrible for me to address it. So, what was I saying? Oh, so I'm on all of those, tried to come off of it, and my I have nightmares every night, and I always have. Like, for the most part, I have just nightmares all the time. The difference is because I'm bipolar and I do still swing some even on all those medications. So I'll go through periods of like mania where my nightmares coincide with my insomnia. So it like is this cycle of I have bad dreams, so I don't want to sleep. Because I'm not sleeping, that I'm like not doing, I'm heightening my mania by not sleeping. And then because I'm heightening my mania, it's just like this vicious cycle of not getting sleep. And I'll go through like 2 weeks to a month of that, and then I'll get like a reprieve for a week or two where I actually sleep at night, and then it'll like go back. And I'm just so used to that. I didn't realize the Seroquel stopped that. The Seroquel does not make me sleepy. I've heard so many people it makes them sleepy. I'm on so many meds that mellow you out from anxiety, and somehow it still does not make me sleepy. But it makes my nightmares not hurt my feelings. It's like the best way I can explain it. I have nightmares still every single night, but I don't have the same emotional response waking up as I used to. Like, used to, if I had a particularly traumatizing nightmare, it would mess up my mood for the whole rest of the day. Like, I would be sad, I would be processing, I would be triggered. It was just like not a great place to live. Not fun. And I didn't realize that the Seroquel had taken that away until I tried to get off the Seroquel, and I was like, nope, we are hopping right back on that because lack of sleep is the last thing I need right now for my health. So I really have to be on it. And because I'm on all of those, it's just not... I just don't know if it's worth risking the medicines if they may not work, because I saw most of them don't work. Like, as far as like medicines for gastroparesis specifically, not like anti-nausea medicines, like normal ones, but like these are for that, at least from what I've like researched and found. So the other options are a feeding tube. And at this point, I feel like I need either a feeding tube or IV nutrition just to bring myself back to an okay level, because I'm smiling and I'm like sitting up and everything, but the only way I'm able to even ignore my pain enough to be functioning is to take CBD gummies. It's literally the only way I'm able to be up and around. If I don't take those, I am in bed, writhing in pain. Everything aches. I'm just like super aware of how painful it all is. And I can't take any normal pain meds. They all just ruin my stomach. And I talked to the GI doctor and she was like, yeah, no, just take the gummies. If those don't upset your stomach, keep with those. I talked to the ER, terrible person, and even he was like, yeah, I mean, it sounds like the gummies are working. So every single doctor I've talked to has all been like, you should keep taking those if those are making your life manageable. But I'm getting tired of it because I just want to be able to eat and drink and like live and have energy, because right now, even when I eat or drink, it doesn't give me energy, it gives me pain. And that's what makes me not want to eat, because if I don't eat, at least my stomach doesn't hurt, at least I'm just exhausted. But I'm getting worried about, like, you know, my organs and things are kind of important, and you kind of need nutrition, and I'm deficient in so many things now, like vitamin wise. I don't know, it's just a hot mess. So I think I need a feeding tube, at least in the beginning, just to get me to an okay place. But I'm like, I don't want to go in there and be like, oh, help me, like a feeding tube is gonna solve all my problems, because I know it's not. Like, I know that it's not gonna fix all my problems. I know that it's not gonna be a pleasant experience. I know that there are health risks and complications that come with it. Like, I understand all of that. But my options are very limited, because I don't think I'm willing to try these medications that I know have serious chance of the side effects, that I'm already on 4 medications that do that, and I cannot be off of those medications and be a functioning person. Like, I can't even imagine. I would end up in psych for at least a month. Hold on. Life of mom, right? You never get an uninterrupted few hours. Okay. So yes, I don't know. I'm conflicted on which one I should do. Everyone in my life, for the most part that I've talked to, has been really awesome and like helping me, decide what I want to do. I think I've landed on trying a tube over the medication, because I can always change my mind about the tube, but I could have side effects of the medication that I won't get that chance with. And I'm getting close to 30. I don't want to I don't want to have to deal with that at this age. So I don't know. If anyone has any thoughts on it, I would appreciate that. I'm kind of just still weighing my options for what I want to say when I go into my appointment, because I'm sure that is going to be a conversation that will help us figure out whether I can go with him or if I'm going to have to go out of network. The issue with that is that I've already been referred to the gastroparesis specialist in my area, and I haven't even been contacted about when to schedule. The GI doctor with that company or whatever, with that hospital doctor stuff, said it could be like up to a year waiting, and I don't have that kind of time. I'm losing weight so fast. I'm just so sick. I got a wheelchair that I have to wear, or that I have to use when we're out in public, because if I bend over and come up, I'll pass out. If I, make a movement too fast or walk across a parking lot or walk upstairs, anything like that, it spikes my heart rate. And you can see my heart racing, it's terrible and dangerous. So we got a wheelchair for me, which I have, it's been a long road of discussion. This wasn't a discussion that was short. It was over months, talking about, whether I'd be willing to do that, because it would make it easier for me to do fun family activities, because right now I just don't do them because I can't be on my feet that long. But they knew it would help, and I knew it would help me get out and about, but I guess I just didn't think I was sick enough, which is something very common. But after I collapsed at the hospital, it just seemed like a good idea to have one for safety reasons. And I got a bath chair a while ago, like a medical bath chair, and that has changed the game. But I'm still very, very sick. I'm having to use these, I can't do this forever. My hair is falling out, my nails won't grow, my skin's a mess, I'm just not well. I know it comes across that I'm really well because I'm smiling and I did my hair today, but I did it sitting down, you know, like I try to look put together, but on the inside, it's a hot mess. We're a hot mess. Um, and like I said, I have to take the gummies anytime I want to get out of bed. So I've taken a good amount to do this video. This is not my normal state. This is me trying to use medicine to function through the pain and the nausea. So yeah, if anyone has any thoughts on it, definitely let me know. It's just, yeah, I'm in a hard place. No answer, nothing that I pick is gonna be good. Like, there's no good options for me at this point. Either I take the risk with the medication or I take the risk with the tube, or I take a risk of neither and literally just disintegrate. You know, I'm already very unhealthy, but it's because I was fat that I'm even okay now. Like, if I as an adult, for like the highest weight I ever got to was like 110. But that was with me going to the gym almost every day trying to build muscle. My normal weight was around 100 pounds. On my at my wedding time, when I got married, I was 97 pounds. So I've always been thin because I've always been throwing up and like just having a time. So if I was that skinny, if I was my normal skinny and I were to get this sick, we would not be in an okay place. We would not be in an okay place. Our being fat is literally saving our life right now. Yeah. I love y'all so very much. I hope this was somewhat informational. This is not meant for everybody. I mean, anybody can watch it, but this is definitely for like the select few that really want to know how we're doing. Because it's like this, just like this. Yeah, I love you all so very much, and thanks for watching. Bye.